Driving around Albuquerque and probably many of the larger cities, we see our unsheltered neighbors. We see more folks living on the streets, maybe struggling with substance use disorder, mental health.
If somebody is experiencing psychotic symptoms that make it so that they aren't aware of the risk of the medical situation or that they aren't able to have an organized conversation about getting the care they need.
I know, you're having a hard time.
We can't just do one or the other. We really need to approach both the medical and the psychiatric at the same time.
The call yesterday came out from APD. This was a patient who, back in November, almost died from exposure, from the cold. And the result of that exposure left him critically ill and very medically fragile.
Where'd you sleep last night, sweetie?
Outside on the corner.
Probably cold, huh?
Yeah.
I'd like you to go to the hospital pretty soon this morning.
When was the last time you talked with your dad?
I'm in the hospital.
Was he worried about you?
Yeah.
Let's get you a cup of coffee and hang out right here, and we're gonna get your friend one too.
We've all been super worried about him, and we need to get him back to the hospital so he can get the help he needs. And thank you. This coffee hopefully will help him get the courage and convince him to go back to the hospital. We're gonna get you kind of cleaned up, and we're gonna take you up to UNM. Working with psychiatry and APD and ACS, we're able to utilize all of our skill sets to get this patient to go back to the hospital so he can get the care that he needs.